solution, not for your sake, but for the sake of the patient, for the sake of the family, you may have to respect it. This is one part of the thing. Second, when somebody says, that's what I was expressing, somebody says there's no side effect, uh, they don't have a knowledge about what is side effect. So I got some skin pigmentation. I go and stand in the sun for 15 minutes, skin becomes more dark. In our language, we call it a side effect. Somebody else may say, no, just healthy ಆಗಿಬಿಟ್ರ ಚಮಕ್ ಕೊಡ್ತಾ ಇದ್ರಿ ಚೆನ್ನಾಗಿದ್ದೀರ ಅಂತ. So that is how you interpret. Lack of knowledge of side effect by a given physician or given system is not to be accepted. You have to say, you have to be very critical. You have to see what are the components of that medicine, what he is giving. Maybe on the bottle or thing it is written there. Go to them, go on the net, find out. If it is significant, discuss with their doctor or discuss with allopathic medicine wallahs. We are famous for so-called declaring side effects. So you have to understand that there is nothing like wrong side effects, no side effects. It is wrong. We are ignorant about it. And in fact, I asked one of my Ayurvedic friends also, in the side effect, you have to study it and isolate it and then study it. ಅಯ್ಯೋ ಅದೆಲ್ಲ ಮಾಡಿಬಿಟ್ರೆ ನಿಮ್ದು ಅದು ಹೋಗಿ ಅಲೋಪತಿ ಆಗಿಬಿಡ್ತದೆ ಸರ್, ಅದಕ್ಕೆ ನಾವು ಮಾಡೋದಿಲ್ಲ ಅಂತ ಹೇಳೋದು. ಸೊ ಅಫ್ಕೋರ್ಸ್ ದಿಸ್ ಇಸ್ ವೆರಿ ಆಫ್ ದ ಕಫ್ ಟಾಕಿಂಗ್. It may not be a representation of the whole Ayurvedic medicine. We respect it. But at the same time, there are certain things which are a drawback when it is done by a Ayurvedic physician. So you have to balance it out. It is a tricky situation, I should say.
I may just answer in a different way about the first question you said about the exercises. Now the patient, whenever he stands up, there is a fall of blood pressure due to Parkinson or due to hypertension disease, and so he is unable to stand and walk. So we will have to address how to stop the fall of blood pressure through the cardiologist or the neurologist. The second thing is, the exercise doesn't mean you have to stand and walk. You can sit on the chair and do this sort of a movement, so because the circulation will improve. Or even when you lie down, you can start doing some exercises. So what we are saying is that there must be a physical movement of the body, not necessarily standing and walking. If it is feasible, yes, definitely. When it is not feasible, even sitting and lying down. Because you must remember, the rest rusts the Parkinson's disease. You will find that a Parkinson patient who has a viral fever, 3 days is bedridden. On 4th day, he says his disease has become worse. Because he has taken rest in the bed, it has rusted. So exercise can be in other position also. The second part you said about Ayurveda. See, there are diseases where we have allopathy has no treatment available. For example, muscular dystrophy, motor neuron disease. In such cases, people are making money out of stem cell therapy, Ayurveda, homeopathy and all that. That's okay, because we have nothing to offer. But in patients like diabetes or even in Parkinson's disease, we definitely have a medicine to offer. Now, when a person takes Ayurveda or homeopathy, I do not know how it interacts with our medicine. Our medicine may go up, causing more side effects, or it may come down, causing less good effects. So I advise my patients that I have no problem if you take Ayurvedic medicine, but I do not know whether your disease will become worse or better, because allopathy, we know if you take this drug and this drug, they will interact and the disease may become worse or better. But we have no knowledge at all about Ayurveda. So my suggestion to our patients is, don't try that, because we have a definite treatment. Now, as you said, everybody asks for side effects. So my standard answer to all my patients is, everything in life has side effects, including marriage. But everybody wants to get married. Why? Because there are so many good effects. The side effects are on the side. When the side effects become more than the good effects, you divorce. So we do the same in allopathy also. When the side effects become much more intolerable, they prefer the primary disease than the side effects, then we stop the medicine. So nobody can guarantee there is no side effect. So I tell them, we have seen our friends divorcing, we have seen our parents quarreling, still we want to get married. Why? Because side effects are on the side, there are very good effects in the main road.
Thank you.
See, anything treatment is evidence-based. With keen observation in the past, whatever the natural substance which is used is considered as Ayurveda. For example, how trihexyphenidyl, so-called Pacitane, was invented. In Paris, models were using this atropine derivative to give luster to their eyes. And one of the physicians, and they were complaining of dryness in the mouth afterwards. One of the physicians who had Parkinson's disease, to prevent drooling of the saliva, why I can't use this atropine derivative? He used it. To his surprise, the tremors have come down. So this is evidence-based. And the second one is, people were using reserpine earlier for treatment of blood pressure. So the people who are taking reserpine, they were complaining of rigidity and Parkinson's-like picture. So one of the physician, the Ayurveda essence is, wherever the poison is there, antidote is nearby. So they searched it, and the levodopa preparation was there, and they used it. And even digoxin, because one old lady was using for swelling of the limbs, leaves, everything got the information like that. But unfortunately, during the British time, our Ayurveda has gone down, and because of the Pandit, they wanted their sons or daughter to continue this, and they suppressed the development of Ayurveda. So if this is evidence-based, it's okay. But as of now, the evidence-based contribution is very less. Recently, America, they have de-recognized homeopathy because of lack of evidence. So unless there is evidence, you should follow that. Otherwise, no evidence-based medicine, no treatment from that angle. Thank you. And regarding the another one, we always talked about treatment, but social responsibility of the doctor is very, very essential, as so in the government. See, we are all sitting in a 3-star or 5-star hotel. 1% of the people after 60 years, whether they are in the rural area or urban area, suffer from Parkinson's. And as the age goes up, the percentage also goes up. And because now the lifespan is long, and we will have lifestyle disease. Now government has considered as non-communicable disease this hypertension, diabetes, stroke, and cancer, and they have given some funds for that. See, unfortunately, we have got so many support group, stroke support group, movement support group, and cancer support group, and so on and so forth. But we are not fighting with the government to allocate the budget for geriatric medicine. It's not Parkinson's. Old age people will have lot of other comorbidity. We should have an advocacy group in each support group, and to reach the government and ask for, see, government cannot take up all the responsibility. Private and public participation should be there. And if I take the you know how costly the treatment is. What about the poor? Everybody talk about Raitar Maga, Nanu, Raitan that's only for some selfish ends. And all government servants at a higher place, and politicians, they all get reimbursement. So we should have some scheme which will help for the poor regarding the treatment as well as the facility. So every medical college should have a dedicated geriatric unit, and whoever takes treatment, if he is poor, whether in private sector or public sector, should be reimbursed by the government. You will have Tali Bhagya, that Bhagya, this Bhagya. Why can't we have one health development scheme and help the poor people to get at least some benefits? So we should have some advocacy group. As doctors and corporate sectors, we have got some social responsibility. Thank you.
Thank you. I think there are quite a few questions everyone will be having. Please feel to discuss during the breaks when all of us are there, and any questions, it will be very easy for you to ask comfortably across the table. Before we go further for introducing the chief guest and felicitation, senior most neurologist and one of the pioneers in neurology in India has passed away recently, today morning. I want Dr. H. Srinivas to just to give a word about him and to have a
I regret to inform you that the father of clinical neurology, Dr. N.H. Wadia in Bombay, J.J. Hospital and subsequently Jaslok Hospital, who was my teacher, he passed away this morning after a protracted illness. So I request all of you to stand for a minute in memory of him.
I would now request Dr. Uma Shankar to come and introduce the chief guest. And before that, I want Dr. Srinath to come down to the side so the people can. Sure.
ಗುಡ್ ಮಾರ್ನಿಂಗ್ ಎವ್ರಿಬಡಿ. ಸೊ ನನ್ನ ಕೆಲಸ ಅಲ್ಲೇ ಶ್ರೀನಾಥ್ ಅವರಿಗೆ ಮಾಡಿದ್ರು, 40 ವರ್ಷ ನೋಡಿದ್ದಾರೆ. ಸೊ ನಾನೇನು ಹೇಳೋದೇನಿಲ್ಲ ಜಾಸ್ತಿ ಈಗ ಅಂತ. ಬಟ್ ಎನಿವೆ ಇಟ್ಸ್ ಮೈ ಡ್ಯೂಟಿ ಟು ಇಂಟ್ರಡ್ಯೂಸ್ ಪ್ರಣಯ ರಾಜ ಡಾಕ್ಟರ್ ಶ್ರೀನಾಥ್. ಸೊ ನಾವು ವೈ ದಟ್ ಡಾಕ್ಟರ್ ಯಾಕೆ ಬಂತು ಅನ್ನೋದು ಒಂದು ಹೆಸರು. ಅಲ್ಲಿ ಹಿ ವಾಸ್ ಕಾನ್ಫರ್ಡ್ ವಿತ್ ಅ ಡಾಕ್ಟರ್ ಆಫ್ ಹಾನರ್ಸ್ ಫ್ರಮ್ ದಿ Open International University for Complementary Medicine, Colombo, Sri Lanka. That was in 2008. ಸೊ ಹಾಗಾಗಿ ಡಾಕ್ಟರ್ ಶ್ರೀನಾಥ್ ಆಗಿದ್ದಾರೆ. ಮುಂಚೆ ಸುಮಾರು ಹೃದಯಗಳನ್ನು ಕದ್ದ ಅವರು ಇವತ್ತು ಪಾರ್ಕಿನ್ಸನ್ ಡಿಸೀಸ್ ಬಗ್ಗೆ ಈ ಸಂದರ್ಭದಲ್ಲಿ ನಮ್ಮ ಜೊತೆ ಬಂದಿದ್ದಾರೆ. ಇವರು when he was born in 1943, he acted in many movies. He started as a child artist. From the age of 8, he was a theatre artist. He started in theatre, then he moved on to movies. 190 ಚಿತ್ರಗಳಲ್ಲಿ ನಾಯಕ ನಟನಾಗಿ ಅಭಿನಯಿಸಿದ್ದಾರೆ. ಮತ್ತು ಹಲವಾರು ಇವರಿಗೆ ಪ್ರಶಸ್ತಿಗಳು ಮತ್ತು ಟೈಟಲ್ಸ್, ಎಸ್ಪೆಷಲಿ ಪ್ರಣಯ ರಾಜ ಬಿಕಾಸ್ ಆಫ್ ಹಿಸ್ ಮ್ಯಾಗ್ನಿಫಿಷೆಂಟ್ ಪರ್ಫಾರ್ಮೆನ್ಸ್ ಇನ್ ದಿ ರೊಮ್ಯಾಂಟಿಕ್ ರೋಲ್ಸ್. ಸೊ ಪೀಪಲ್ ಆಫ್ ಕರ್ನಾಟಕ gave him that title. Then he was given many other titles called Abhinaya Chakravarti, Abhinaya Kalaratna and all that. So he has also won the best actor for the film Besuge, a Filmfare Award for the best actor. And he has participated in many seminars and conferences. He is also associated with a lot of organization. ಅದಕ್ಕೆ ಸರ್ ಜಸ್ಟ್ ಒಂದು ಹೆಡ್ಲೈನ್ಸ್ ಮಾತಾಡ್ತಾ ಇದ್ದೀನಿ, ಹೆಡ್ಲೈನ್ಸ್ ಮಾತಾಡ್ತಾ ಇದ್ದೀನಿ. ಓದೋಕೆ ಹೋಗ್ಬಿಟ್ಟಿದ್ದು ನನ್ನ ಭಾಷಣ ನಂದೇ ಹೋಗ್ತಿದ್ದೀವಿ ಇವತ್ತು. ಪ್ರಶಾಂತ್ ಕೊಟ್ಟಾಗ ಇದನ್ನ ಎಷ್ಟೊಂದು ಪೇಜ್ ಕೊಟ್ಟಿದ್ದಾನೆ ಅಂತ ಅಂದ್ಕೊಂಡೆ. ಬಟ್ ಎನಿವೆ, ದಿಸ್ ಈಸ್ ಪ್ರಣಯ ರಾಜ ಡಾಕ್ಟರ್ ಶ್ರೀನಾಥ್ ಫಾರ್ ಯು. ಸೊ
wise
request
to.
Dr. Srinath to address few
Do
words.
you know that the
ನಮಸ್ಕಾರ. ಒಂದು ಸಂತೋಷ ಅಂದರೆ ನಿಜವಾದ ಡಾಕ್ಟ್ರುಗಳ ಮಧ್ಯೆ ಎಲ್ಲೋ ಅಚಾನಕ್ಕಾಗಿ ಡಾಕ್ಟ್ರ್ ಆದನ್ನು ನಾನು ಕೂತ್ಕೊಂಡಿದ್ದೀನಿ. ಬರುತ್ತೋ ಬೀಳುತ್ತೋ ಗೊತ್ತಿರಲಿಲ್ಲ. ನಾನು SSLC ಪಾಸು, PUC ಫೇಲು, ಡಿಪ್ಲೊಮಾ 3 ವರ್ಷ ಇದೆ, 6 ವರ್ಷ ಮಾಡಿದೆ, 6ನೇ ವರ್ಷನೂ ಕೊನೆ ವರ್ಷ ಕಂಪ್ಲೀಟ್ ಮಾಡೋಕ್ಕಾಗಲಿಲ್ಲ. ಜೀವನದಲ್ಲಿ ಏನೋ ಸ್ವಲ್ಪ ಮಾಡಿಕೊಂಡು ಒಂಚೂರು ಸಾಧಿಸಿದ್ದೀನಿ. ಅದಕ್ಕೆ ಡಾಕ್ಟ್ರೇಟ್ ಅಂತ ಕೊಟ್ಟಾಗ ಈ ಡಾಕ್ಟ್ರುಗಳ ಮಧ್ಯೆ ಇಷ್ಟು ಎಕ್ಸ್ಪೀರಿಯೆನ್ಸ್ಗಳ ಮಧ್ಯೆ ಕೂತ್ಕೊಳ್ಳೋದು ಸ್ವಲ್ಪ ಸಂಕೋಚವಾಗಿತ್ತು. ಆದರೆ ಅಷ್ಟೇ ಆತ್ಮಸ್ಥೈರ್ಯನೂ ಬಂತು, ಡಾಕ್ಟ್ರುಗಳ ಜೊತೆ ನಾನು ಕೂತಿದ್ದೀನಿ ಅಂತ. ಇಲ್ಲಿ ಪಾರ್ಕಿನ್ಸನ್ ಇದ್ರ ಬಗ್ಗೆ ತುಂಬ ಹೇಳಿದ್ರು, ತುಂಬ ಓದಿದ್ದೀನಿ. ನನಗೆ ಒಂದು ಅನಿಸುತ್ತೆ, ಮನುಷ್ಯ ತನ್ನ ಮನಸ್ಸನ್ನು ಯಾವತ್ತೂ ಸಂತೋಷವಾಗಿ ಸ್ವಚ್ಛಂದವಾಗಿ ಇಟ್ಕೊಂಡ್ರೆ ಈ ಯಾವುದೇ ಕಾಯಿಲೆಗಳು ಬರೋದಕ್ಕೂ ಸ್ವಲ್ಪ ಯೋಚನೆ ಮಾಡುತ್ತಂತೆ. ಈ ಯೋಚನೆ ಮಾಡುತ್ತೆ, ಅದು ಕಾಯಿಲೆ ಬರೋದಿಲ್ಲ ಅನ್ನೋದು ಜೀವನದಲ್ಲಿ ನನಗೆ ಎವಿಡೆನ್ಸ್ ಸಿಕ್ಕಿದ್ದು. ನೀವು ಹೇಳ್ತಿರಲ್ಲ ಎವಿಡೆನ್ಸ್ ಅಂತ, ನಮ್ಮಪ್ಪನೇ 100 ವರ್ಷ ಬದುಕಿದ್ರು ಅವರು. 99ನೇ ಇಸ್ವಿಲೂ ಅವರು ಕೋರ್ಟ್ಗೆ ಹೋಗಿ ಆರ್ಗ್ಯೂ ಮಾಡಿದರು, ಲಾಯರು. ಚೆನ್ನಾಗಿ ಇಟ್ಕೊಂಡಿದ್ರು, ಯಾವತ್ತೂ ಕೋಪಿಸ್ಕೊಳ್ಳಿಲ್ಲ, ಯಾವತ್ತೂ ಆಸೆ ಪಡಲಿಲ್ಲ. ಮನುಷ್ಯ ಇರೋದು ಒಂದು ಜೀವನ ಚೆನ್ನಾಗಿ ಬಾಳಬೇಕು ಅಂತ ಆನಂದವಾಗಿ ಬದುಕಿದ್ರು. ಮಕ್ಕಳನ್ನೂ ಅಷ್ಟೇ ನೋಡಿಕೊಂಡ್ರು. ನಮ್ಮಪ್ಪನೇ ಹಾಗೆ ಬದುಕಿರ್ಬೇಕಾದ್ರೆ ನಾವು ಯಾಕೆ ಬದುಕಲ್ಲ